Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jambus. Today we'll be doing the part 2 of chapter 29, Psychosis. Psychotic manifestations are characterized by slowness of recovery. So all the psychotic manifestations, they will have a slow recovery. The subject is constantly slipping backwards because of the destructive character of the stigma. So instead of moving forward, the person, he slips backwards because of the destructive stigma, rather the destructive character of the stigma. So therefore, the recovery is slow. Now let us see some mental symptoms and other symptoms for the same. The mental symptoms are: the psychotic patient is exceedingly suspicious. So suspiciousness is another hallmark of the psychotic miasm on the mental symptom. The suspicion extends to the point where he dares not to trust himself, and he must go back and repeat what he has done or said, and wonders if he goes back and starts again. So there is so much of suspicious that he cannot trust himself. Whatever he has done, he must go back and see and again repeat what he has done or said, and he wonders why has he said this, and he again goes back. So there's too much of suspiciousness. He doesn't trust himself or even other persons. So much so that whatever he does, he is suspicious that he or she hasn't done this part properly. So he'll again go recheck, reconfirm, and try and take away his suspicion. He is suspicious that he will be misunderstood, that his hearers will give the wrong meaning to what he is attempting to convey. So the suspiciousness will be that the other people have not clearly understood what he has to say, or the other person whom he is talking to may convey a wrong meaning of what he has said. Therefore, the suspiciousness, or rather, therefore, the suspiciousness arises. This suspicion, when turned upon others, leads to the worst forms of jealousy of his friends, for he knows full well that he is not understood. So this suspiciousness then will go on to jealousy of his friends, of his neighbors, of his other, or rather of his other, also other friends or close relatives. Why? Because he thinks that he's not well understood. So there are two most important mental symptoms: suspiciousness and jealousy. So suspiciousness and jealousy are two hallmark symptoms on the mental plane of the psychotic miasm. Due to the basic suspicion and jealousy, patient will resort to any and all means of freeing themselves from this stigma. So they may go to any level in order to free themselves from this basic suspiciousness and jealousy. Thus, the person gets suspicious and quarrelsome, and he has a tendency to harm others and to harm animals. So because of his suspiciousness and because of his jealousy, he will be very quarrelsome and he will tend to harm other people and also animals. This produces the worst form of cruelty and deceit and the worst form of mania of any of the stigmata. So when the suspiciousness and the jealousy gets heightened, they produces a worst form of cruelty and deceit. The person is also cross and irritable and is absent-minded. He cannot find the right words to express himself. So memory will be also deficient. He seems less confident and forgets recent happenings. So his confidence is less, and whatever he's done recently, he will also forget that. However, remembers distant events very clearly. So memory poor for recent events, but very good for the past events. There is a union of two stigmas, namely of psychosis and syphilis. Then the fixed ideas are more prominent and slowness of mental power. So when the stigma of psychosis is mixed with syphilis, that is when you get two miasms in the same person, then what will happen? There are more fixed ideas and there will be more slowness of the mental power or dullness of the mental power because of the syphilitic stigmata. Even there will be a dangerous manifestation of anger. So whatever symptoms of psychosis are there on the anger level, they are not expressed. So the person will start brooding, sensation as if a cloud has been the head has been surrounded by a cloud. He cannot think correctly. He forgets the things what he has read. But when the syphilitic miasm is there, this gets exaggerated. That means what will happen? There'll be a dangerous manifestation of anger. So whatever slowness is there, whatever cloud sensation is there covering the head, all that will be exhibited in the form of an action. So there will be dangerous manifestation of anger. So the person will now exhibit its anger by throwing things, by cursing, by hitting the other person, and so on and so forth. So there is dangerous manifestation of anger, especially when psychosis is mixed with the syphilitic stigmata. The modalities. When some external manifestation occurs, such as a catarrhal condition or leukorrhea, or even the return of the menstrual symptom, there is a general amelioration of the mental condition. So in the modalities, please remember that abnormal discharges ameliorates the patient. So any abnormal discharge, either from the nose, from the mouth, from the lungs, from the uterus, from the anal region, any abnormal discharge, the patient feels better. There is always better in general from the returning or breaking up of old ulcers or old sores, and markedly better by the return of the old gonorrheal manifestations. In short, the psychotic persons are better by abnormal discharges. If you compare SORA, in my previous video of SORA, I've told you that in the SORA, the modalities of amelioration are better by normal discharges. And so this is the differentiation between the SORA and the psychotic amelioration modality. While there is a much amelioration by eliminative process, natural elimination such as diarrhea, free urination, or even perspiration does not ameliorate. So, as you all know, the psychotic symptoms are better by abnormal discharges. So, normal discharges like perspiration, diarrhea, urination does not ameliorate the patient. Now, the head symptoms. The headaches are located in the vertex, or they may be frontal headaches. So, you may get a frontal headache, or you may get a headache on the vertex. These are aggravated by lying down at night, especially after midnight. There are feverish headaches of children. This patient is restless and wants to be kept in motion, which ameliorates. The head symptoms resemble the syphilitic stigmata, wherein they have night aggravation, and there is the same type of vertigo at the base of the brain. So in the syphilitic stigmata, the main aggravation is at night time. So therefore, the head symptoms also, like the syphilitic stigma, they have an aggravation at the night time. The hair falls out in circular spots, especially of the beard. The psychotic scalp perspires, but there are not the moist matted eruptions of syphilis. So the child perspires profusely on the scalp, but there are no eruptions on the scalp as you will get in syphilis. That in syphilis you will be getting the moist matted eruption on the scalp. Eye symptoms, arthritic troubles of the eye are a combination of psychosis and SORA. There are also neuralgias, which are aggravated on change of weather, by change of barometer and the rainy weather. So, in the psychotic symptoms, aggravation in the rains are also very, very important. Nose symptoms, the psychotic usually has a red nose with prominent capillaries. The sense of smell is lost. There is often nasal stoppage due to thickening of the membranes and enlargement of the turbinated holes. So the nasal mucous membranes gets inflamed, it gets enlarged, there is stasis, so again psychotic element, and also the turbinates may get enlarged. Except in acute course, the discharges are scanty. The slightest amount of discharge, however, ameliorates the patient. As I told you, abnormal discharges ameliorate the patient. So the patient gets a cold, and if he gets a thick yellow, green, or a white discharge from the nose, the patient feels better. Children with snuffles are usually syphilitic or psychotic. The psychotic stigma has moist sniffles, but without ulceration or crust. The discharge is purulent scanty with the odor of fish brine. So again, fish brine odor is another characteristic odor of the psychotic miasm. Hay fever is an expression of syphilitic and latent psychosis, very often with a soric taint. So hay fever has all the miasms, the sora, the syphilitic, as well as the psychotic miasm. Now the discharges. In the psychotic discharges, the fish brine odor is characteristic of the psychotic trait. As I just told you, the psychotic odor, the odor of the psychotic discharge will be a fish brine-like odor. It may appear in all the discharges, but especially the discharge from the genital tract. The psychotic discharges, like the tubercular, are greenish or greenish yellow. So in psychotic discharges, you generally get greenish yellow discharge. There is more element of the green as compared to the yellow. Rheumatic symptoms. The psychotic patients are especially liable to rheumatic troubles, especially if there has been any attempt to suppression of the rheumatic manifestations. We find reflux troubles in the heart with violent hammering and beating. So if the joint pains are there or rheumatic troubles are there, and if suppressive treatment is taken, the disease travels from the less important organs to the more important organs, from the rheumatic joint troubles to the heart. And what will you get? You get violent hammering and beating. Or the heart, there will be tachycardia. Hence, suppression of rheumatic complaints, the heart gets affected. So this is very important in psychosis. Whenever the rheumatic complaints are there, whenever they get suppressed, the heart will get affected. There are tearing pains in the joints, which are aggravated during rest, during cold temp weather, better by moving or stretching, and dry weather. There are pains in the small joints with infiltrations and deposits. So the small joints are there, of the fingers, of the toes, and you may get gouty depositions or infiltrations of uric acid. The gouty diathesis has a psychotic base. Stiffness, soreness, and lameness are the characteristics of this stigma. So people with rheumatic complaint will have stiffness, will have soreness, will have lameness, will have gouty infiltration, and these particular modalities. Now, cardiac symptoms. In the combination of psychosis and sora, we get the right soil for valvular and cardiac disturbance. So when psychosis is mixed with sora, it forms a perfect soil for the development of the valvular heart diseases as well as cardiac disturbances. The resultant changes in the organic structure of the heart causes many fatalities. So there may be some organic structure in the heart as a result of which it may prove fatal to the individual. Heart conditions are associated with fear and apprehension, just like the soric patients. So whenever they get the heart complaints, or whenever they get their palpitations, or whenever they get tachycardia, or whatever symptoms pertain to the heart, they are always associated with fear and apprehension. They're extremely worried. When the syphilitic stigma associated with the psychotic stigma, it develops a more dangerous heart complaints as compared to that of sora. But however, Robert says that whenever the syphilitic stigma is associated with the psychotic stigma in the heart complaints, it becomes a much more dangerous symptoms are produced as compared to when psychosis and sora is there in a combination form. So when psychosis is combined with the syphilitic stigmata in the cardiac diseases, there will be a more dangerous heart complaints as compared to psychosis and sora alone. When it is in combination, it doesn't produce such dangerous heart complaints, but there may be some changes which may be quite disturbing to the patient, and the patient has great fear and apprehension. The soric patient worries about this condition, takes his pulse frequently, fears death, and remains quiet. So if the psychotic miasm is there with the soric miasm in the cardiac complaints, then the most prominent symptom will be of worry, anxiety, apprehension, that the patient will continuously take his pulse, he fears death, and remains quiet. So he constantly checks his pulse, he sees, is the pulse beating properly, will I be alive, or I think I will die, and he remains very quiet and he sits in one corner. While syphilitic and psychotic patients have no mental distress and may have no subjective heart symptoms, they die suddenly without warning. So in the psychotic patients, especially when psychotic is mixed up with the syphilitic stigmata, they generally may not have a mental distress, but however, they will die suddenly without any ward. So that is the weightage of the syphilitic miasm. How or you can say how bad symptoms the syphilitic miasm develops, or it may not even develop any symptom, and suddenly the patient may die without any warning. If there are no pains about the heart and dyspnea, these conditions are better. If there are pains about the heart and dyspnea, these conditions are better from gentle exercise such as slow walking or riding. So it's another important modality that whenever the heart is affected, there is dyspnea, patient feels better by slow walking. When there is any trouble about the heart in psychotic patients, there is usually some dyspnea. So whenever the heart is affected and the psychotic stigmata is there, it is always associated with dyspnea. These patients have a soft, slow, easily compressible pulse, and the valves are rough. So the patient's pulse is soft, slow, you can feel it, and the valves are also involved. The muscles become flabby and soft, and in long continued cases, they lack power. So what will happen? The heart muscles will become flabby, the heart may become enlarged, and they lack the contractile power of the heart to pump properly. As a rule, these patients are fleshy and puffy. Their obesity is a cause of their dyspnea. So just like the psychotic patients, they are obese, they are fat, and they are edematous. And this may also contribute a part of their dyspnea along with the heart complaints. So obesity may exaggerate the dyspnea, or it may increase the dyspnea. Frequently, the face becomes bluish and cyanotic, sometimes with venous congestion. So sometimes you may also have the dyspnea is quite profound. If the heart is quite enlarged, not pumping properly, then the face may become bluish or cyanotic and with venous congestion of the face. These conditions are very much aggravated by high living, rich spicy food, or spirituous liquor. So this will occur when the patient takes rich spicy food, or they take some liquor or spirituous liquors, and they have high living. Now, desires and aversions. Meat arouses the latent psychosis, as in Sora. The psychotic patient should take meat sparingly, and it's better for him to use more frequently nuts, beans, and cheese. So the psychotic patient desires nuts, beans, and cheese. Meat doesn't suit the patient much. Gouty conditions cannot digest meat. Also craves for beer, and while it's not as desirable element for his diet, it may cause less aggravation than the wines do. So also the patient takes beer, which he craves for, but it will cause a less aggravation, and wine causes much more of an aggravation. So the patient may crave for wine or beer. Beer may not have such an aggravation as compared to the wine when the patient takes wine. So the craving for, please remember, nuts, beans, cheese, beer, and wine. But beer and wine may aggravate the patient just like meat, which aggravates the patient. So that's all for this video. The last part 3 of psychosis, will be coming up soon. Hope you like this video. If you like this video, please give it a thumbs up and also share this video. Thank you very much.